Hello all, welcome to this new lecture. Today we are going to discuss about pancreas, its anatomy, its clinical importance, why it is important to study anatomy, its development and histology also. So before we start our lecture, please subscribe to my channel by clicking the subscribe button below. Okay, let's start our lecture now. What do you know about pancreas? Pancreas is a gland. It is situated in abdominal cavity. It helps in digestion and it also helps in maintaining blood glucose level. At least you should know these basic things. Okay, so we'll start our lecture. Pancreas is soft, lobulated and elongated organ. Okay, so it is elongated, soft and lobulated. Okay, it is a gland which is partly exocrine and partly endocrine. So what does exocrine and endocrine means? Exocrine means it secretes its hormone directly to the blood, and endocrine means it secretes its secretions with the help of a duct. So every gland will be secreting something. So endocrine glands secrete hormones, exocrine glands which have different type of secretions, like some have digestive juice, some have sebaceous secretion. Sweat glands secrete sweat also. So see this picture, this is an example of exocrine gland. See, these are cells of gland which secretes something. Okay, so this secretion is carried to its destination with the help of this duct. See, this is duct. Okay, so that is exocrine gland. Here these are glandular cells. Okay, the secretion from this gland, which is hormone, is released directly into blood. Okay, so they are endocrine glands. So that's the difference between endocrine and exocrine. Okay, so the pancreas is a mixed gland which has exocrine part and endocrine part. So the exocrine part of pancreas secretes digestive pancreatic juice, whereas the endocrine part secretes the hormone insulin. I'm sure you have heard about insulin. Okay, next we will discuss the location across the posterior abdominal wall. Suppose this is your abdomen, this is your anterior abdominal wall, this is your posterior abdominal wall. Okay, so pancreas is lying in the near the posterior abdominal wall. Okay, and it's lying transversely also, like this. See. Okay, so what are the levels? It lies at the level of L1, L2 vertebrae. L1 means lumbar 1, lumbar 2 vertebrae. The size, it is J-shaped and set obliquely. J shape is this one. See the J shape. So its length is 15 to 20 centimeters. Its breadth is 2.5 to 3.8 centimeters. Thickness is 1.2 to 1.8 centimeters. And weights about 90 grams. Okay. Now the pancreas is divided into head, neck, body and tail. First we have the head. This is head. Okay, next is neck. This part is neck of pancreas. Now we have the body, and last we have the tail. So what is this one? This is the uncinate process. It is a projection from the head of pancreas called uncinate process. This is our spleen. The spleen is situated near the tail of pancreas. Next, head is enlarged and lies in the concavity of duodenum. See, compared to the body, the head is enlarged. Okay, so where it lies, this is your duodenum. This is first part of duodenum, second part of duodenum, third part and fourth part. So see, the head is enclosed by the duodenum. The tail of the pancreas reaches the hilum of spleen. See, tail of the pancreas, this is the hilum of spleen. Next, the entire organ lies posterior to stomach and separated from it by the lesser sac. Okay, so the pancreas lies posterior to stomach, behind the stomach. Okay, so the whole pancreas is situated behind the stomach. So between the stomach and pancreas we have lesser sac. So the pancreas is separated from stomach by lesser sac. Okay, now we'll discuss head of pancreas. Head is enlarged right end of pancreas. See, this is the pancreas. This here is your left side. This is right side. Okay, here you have your spleen in the left side. Okay, so head is the enlarged right side of pancreas. This is right side, this is enlarged part, this is your head. Okay, situated within the C-shaped curve of duodenum. Situated within the C-shaped curve of duodenum. See, head is situated in this C-shaped curve of duodenum. Next, we'll discuss the external features of head of pancreas. The head of pancreas has 3 borders, 2 surface and 1 process. What are the borders? We have superior border and inferior border. This is your head. So this is your superior border, this is your inferior border, and we have right lateral border. This is your right lateral border. So we have 3 borders: superior, inferior and right lateral. Okay, we have 2 surfaces, anterior and posterior. This is your anterior surface, behind this is your posterior surface, and we have 1 process which is uncinate process. This is your uncinate process. Okay, now we'll discuss the relations of head of pancreas. So first we'll discuss the 3 borders: superior border, inferior border and right lateral border. The superior border, which is overlapped by first part of duodenum, and it also has superior pancreatico-duodenal artery. The inferior border, which has the third part of duodenum and inferior pancreatico-duodenal artery. The right lateral border, which has second part of duodenum and terminal part of bile duct and anastomosis between 2 pancreatico-duodenal artery. See, this is our superior border, this is our inferior border, this is our right lateral border. In the superior border, you have superior pancreatico-duodenal artery. Here we have first part of duodenum. So superior border we have first part of duodenum and superior pancreatico-duodenal artery. In the inferior border we have inferior pancreatico-duodenal artery and the third part of duodenum. Okay, in the right lateral part we have second part of duodenum, and the superior pancreatico-duodenal artery and inferior pancreatico-duodenal artery comes here and anastomosis with each other. You will learn more about this artery when we discuss about the blood supply. The bile duct is coming like this and joins with pancreatic duct and opens into second part of duodenum. So in the right lateral border we have relation the terminal part of bile duct. Now we have 2 surfaces, anterior surface and posterior surface. Anterior surface we have first part of duodenum, transverse colon and jejunum. See this picture, this is the anterior surface. Here we have first part of duodenum. We already know that first part of duodenum comes here, second part of duodenum and third part of duodenum. So first part of duodenum is in the anterior surface. Here we have transverse colon. See, the ascending colon comes like this and here you have your liver. This is hepatic flexure of colon. So now transverse colon goes like this and later comes down as descending colon. Okay, then we have jejunum here. Next, the posterior surface. Posterior surface, we have inferior vena cava, terminal part of renal vein, right crus of diaphragm and bile duct. So this is our head of pancreas. This is the uncinate process. Okay, anteriorly we have discussed. So what is present posteriorly, which means behind this we have our, this is inferior vena cava. Okay, so inferior vena cava is receiving two tributaries. This is right renal vein and this is left renal vein. Okay, and I have mentioned we have second part of duodenum here. So bile duct is opening into second part of duodenum. So the terminal part of bile duct is also present posterior to head of pancreas. Okay, and this is, we have our liver here and we have a diaphragm here. So this is the right crus of diaphragm. Okay, next we'll discuss the uncinate process. Uncinate process, anteriorly we have superior mesenteric vessels and posteriorly we have aorta. See, this is uncinate process. So anteriorly we have superior mesenteric vessels. What we have posteriorly? This is uncinate process. Okay, we have, this is our aorta. Okay, you know superior mesenteric vessels, right? If this is your abdominal aorta, we have three branches coming from the anterior part of aorta. They are, one is celiac trunk, another one is superior mesenteric artery, the third one is inferior mesenteric artery. So this superior mesenteric artery, this is it. Okay, the uncinate process, anteriorly we have superior mesenteric artery and superior mesenteric vein. Posteriorly we have aorta. Next we'll discuss the neck of pancreas. Neck is slightly constricted part between head and body. Okay, neck has two surfaces, anterior surface and posterior surface relations. So anterior surface of the neck we have pylorus of stomach and the peritoneum covering posterior wall of lesser sac. In the posterior surface, we have termination of superior mesenteric vein and the beginning of portal vein. Okay, we'll discuss it now. So this is our neck of pancreas. Okay, we have our pylorus anteriorly. So the stomach is situated here. This is our stomach. So the last part of stomach, the pylorus, is situated anterior to the neck of pancreas. Okay, so what is present behind this neck of pancreas? Posteriorly we have portal vein formation. How is portal vein formed? The splenic vein is coming from here. This is our splenic vein. This is our superior mesenteric vein. So the superior mesenteric vein and splenic vein joins together to form portal vein. So in the posteriorly we have the portal vein formation. Next we will discuss the body of pancreas. The body of pancreas is elongated. Okay, elongated, extends from the neck to the tail. External features, which is triangular on cross section. So when we cut the pancreas cross section, this is how pancreas, body of pancreas looks like. It is triangular on cross section. So it has three borders. This is anterior, superior and inferior. So we have three borders: anterior, superior and inferior, and we have three surfaces. This is anterior surface, this is posterior surface, this is inferior surface. Okay, clear? Three borders: anterior, superior, inferior. Three surface: anterior, inferior and posterior. Okay, next tuber omentale. It is the part of the body projects upwards beyond the rest of the superior border. Okay, see, this is our superior border. This part which is projects upwards compared to the other superior border, this is called tuber omentale. Okay, now relations of body of pancreas. First we'll discuss the three borders: anterior border, superior border and inferior border. The anterior border, which is this one, is attached to the root of transverse mesocolon. We have discussed that transverse colon is coming like this. Okay, so the peritoneum from the transverse colon will be attached to this anterior border. Okay, I'm talking too much about the peritoneum. If you have not watched my previous lecture about peritoneum, I will link it in the description below. You can watch it from there. Next we have superior border. The superior border, we have celiac trunk, hepatic artery and splenic artery. So this is our celiac trunk. So from the celiac trunk we have three branches. One is splenic artery, next is left gastric artery, then third is common hepatic artery. So the celiac trunk, splenic artery and hepatic artery is related to the superior border. The inferior border, we have superior mesenteric vessels. See, this is the inferior border. Here we have these two superior mesenteric vessels. Okay, now we have three surfaces: anterior surface, posterior surface and inferior surface. First we will discuss anterior surface. If this is pancreas, what is present in front of pancreas? We have stomach, but between stomach and pancreas what we have? It is lesser sac. So lesser sac is created by peritoneum. Okay, so in the anterior surface we have peritoneum, lesser sac and stomach. Okay, so in the posterior surface we have no peritoneum. So what we call it, the pancreas is retroperitoneal. I will explain it now. This is your abdominal cavity. Suppose, okay, peritoneum is not covering entirely the abdominal cavity. It is not like this, not like this. The peritoneum is not covering completely. Peritoneum is covering like this. So any organ which present inside this peritoneum is intraperitoneal. If some organ is present here, so according to this organ, this is his anterior. Anteriorly we have peritoneum, but posteriorly there is no peritoneum. So this organ is situated, when compared to this peritoneum, this is peritoneum, and compared to this organ is situated behind the peritoneum. So it is called retroperitoneum. Behind the peritoneum. So pancreas is situated behind the peritoneum. So it is called retroperitoneal organ. Okay. So posterior surface we don't have any peritoneum, but we have aorta, left crus of diaphragm, left suprarenal gland, left kidney, left renal vessels and splenic vein. This is the body. This is the left crus of diaphragm. This is our kidney, left suprarenal gland. So vessels coming to this left kidneys, left renal vessels and splenic vein. See the vein coming from the spleen. This is splenic vein. These are its posterior relations. Now the inferior surface. In the inferior surface, what we have? It is covered by peritoneum. We have duodenojejunal flexure, coils of jejunum and left colic flexure. First part of duodenum, second part of duodenum, third part of duodenum, fourth part of duodenum. From here, duodenum combines with jejunum. So this is called duodenojejunal flexure. Then we have jejunum here, and transverse colon is coming like this. So here we have liver, here we have spleen. So flexure of transverse colon here, it's called hepatic flexure of colon or right flexure of colon. Here we have spleen, so we call it splenic flexure of colon or left flexure of colon. So in the inferior surface we have duodenojejunal flexure, coils of jejunum, and left colic flexure. That's this one. Okay. Next we will discuss the tail of pancreas. It is the left end of pancreas, lies in the lieno-renal ligament together with splenic vessels. Lieno-renal ligament, what is it? Lieno means spleen, renal kidney. So what is ligament? The ligament is the peritoneum that is attaching between two organs. So lieno-renal ligament is the peritoneum that is attached between spleen and kidney. Okay, so the tail of pancreas lies in the lieno-renal ligament together with splenic vessels. See, this is splenic artery, splenic vein is here. Okay. Next we'll discuss duct of pancreas. So what is duct? Pancreas is an exocrine as well as endocrine gland. So the exocrine part of pancreas, its secretion, the pancreatic juice, is delivered to its site by this duct. What are their ducts? The main pancreatic duct and the accessory pancreatic duct. The main pancreatic duct of Wilson, which is 3 mm in diameter and lies near the posterior surface of pancreas. So the main pancreatic duct is situated in the posterior surface of the pancreas, behind the pancreas, not in the bulk of the pancreas. Okay, of course it's inside the pancreas but close to the posterior surface. So it begins at its tail, runs through the body and bends at the neck and runs to the head. Within the head of pancreas, the pancreatic duct is related to the bile duct, which lies on its right side. The two ducts enters the second part of duodenum and joins to form hepatopancreatic duct or ampulla of Vater. And then it opens into the major duodenal papillae. See, the main pancreatic duct starts from the tail of pancreas and it runs through the body. In the head it bends and comes here. Okay, and this is the bile duct, common bile duct, which is coming like this and joins with main pancreatic duct and forms hepatopancreatic duct, also known as ampulla of Vater. So which opens into the second part of duodenum at the major duodenal papillae. This is the major duodenal papillae. Okay, see this, it's coming here, joins with bile duct and forms hepatopancreatic duct, opens into major duodenal papillae at the second part of duodenum. Okay, the main pancreatic duct also receives small tributaries. Okay, they joins the main duct at an acute angle, which is V-shaped pattern known as herringbone pattern. See, this is the main pancreatic duct which receives many tributaries. See, so this tributary is forming an acute angle, a V pattern. So that is called herringbone pattern. Now we have accessory pancreatic duct of Santorini. It begins at the lower part of head and opens into minor duodenal papillae. See, this is the accessory pancreatic duct which starts from the uncinate process lower part of the head and opens into minor duodenal papillae. See, this is the minor duodenal papillae in the second part of duodenum. Okay, next the arterial supply. Pancreas is supplied by pancreatic branch of splenic artery, which is the main blood supply, and we have superior pancreatico-duodenal artery and inferior pancreatico-duodenal artery. See, I have discussed that there are three branches from the anterior part of abdominal aorta. They are celiac trunk, superior mesenteric artery and inferior mesenteric artery. This is the celiac trunk. This is the superior mesenteric artery. Okay, so the celiac trunk, from there we have three branches. One is common hepatic artery, the other one is left gastric artery, the third one is splenic artery. So the three branches are common hepatic artery, left gastric artery and splenic artery. Okay, from the common hepatic artery we have gastroduodenal artery. Okay, this gastroduodenal artery gives the branch superior pancreatico-duodenal artery. Okay, from the superior mesenteric artery it gives inferior pancreatico-duodenal artery. So the superior pancreatico-duodenal artery and inferior pancreatico-duodenal artery anastomosis with the right lateral border of the head. We discussed it when we discussed about the head of pancreas. Remember that the upper border superior pancreatico-duodenal artery, lower border inferior pancreatico-duodenal artery, the right lateral border the anastomosis. Okay, and this is the splenic artery. Splenic artery gives multiple branches into the pancreas. So the blood supply to the pancreas is mainly by splenic artery, then superior pancreatico-duodenal artery and inferior pancreatico-duodenal artery. The venous drainage. Veins drain into the splenic vein, superior mesenteric vein and portal vein. See, superior mesenteric vein combines with splenic vein forms the portal vein. Portal vein is formed at the neck of pancreas. Okay, so the venous blood is drained into these three veins: splenic vein, superior mesenteric vein and portal vein. Okay, now lymphatic drainage. The lymphatics follows the arteries and drains into pancreatico-splenic node, celiac node, superior mesenteric node. Okay, nerve supply. Pancreas is supplied by vagus or parasympathetic and splenic sympathetic nerves through the plexus around its arteries. The sympathetic nerve is vasomotor in nature, while the parasympathetic controls the pancreatic secretions. Now we will discuss the functions of pancreas. The main function of pancreas is digestion. So it helps in digestion. How? It contains many digestive enzymes. What are they? It contains trypsin, amylase and lipase. So the complex food we have eaten should be broken down into its minute particles like glucose, fatty acid and amino acids. Okay, so the trypsin which breaks down protein into its lower peptides, while the amylase hydrolyzes starch and glycogen into disaccharides, while the lipase break down fat into fatty acid and glycerol. So the main function of pancreas is digestion by these digestive enzymes. Next we have endocrine part. Endocrine part, insulin is synthesized by the pancreas, which helps the utilization of sugar in the cells. So the pancreas helps to maintain the blood sugar level. So the deficiency of insulin may result in hyperglycemia, which is called diabetes mellitus. The pancreatic juice, which also provides alkaline medium for the activity of pancreatic enzymes. Now let's discuss the clinical anatomy of pancreas. The main and major important thing is diabetes mellitus. Okay, what is diabetes mellitus? The pancreas is secreting insulin. If there is insulin deficiency, or if the insulin they have secreted is not working, in that case the blood contains glucose. So this glucose has to be taken into the cells. Okay, so who do this? With the help of insulin. Insulin helps to transport this glucose into the cell. So if there is no insulin, this glucose cannot be transported, which means the blood contains more glucose, but the tissues, the cells, they are not getting enough glucose. This condition is called diabetes mellitus. Next, the carcinoma of the head of pancreas. Okay, see, this is our pancreas. This is the carcinoma of head of pancreas. So what can happen? It can lead to pressure over the bile duct. See, this is the second part of duodenum. Bile duct is coming like here. So if a cancer is here, it can compress the bile duct. So what happens? Pressure over the bile duct leads to obstructive jaundice. Okay. Next, the pressure over the portal vein can lead to ascites. You know the portal vein is formed here by the superior mesenteric and splenic vein. So cancer here leads to portal hypertension, which can lead to ascites. See, ascites means the fluid accumulated in the abdominal cavity. Okay. Now, if it involves the stomach, it leads to pyloric obstruction. See, if the cancer which is compressing this area, here it's obstructed, so the food can't pass through this, which leads to stomach distension. Now the next thing is acute pancreatitis. Acute pancreatitis is a serious disease. It may be a complication of mumps. Okay, now we have vaccine for that: mumps, measles, rubella. Pancreatic cyst. What is pancreatic cyst? It is large fixed tumor which is often symptomless. See, these are examples of pancreatic cyst. Pancreatic pain. Any pain in the pancreas which is felt in the back and front of abdomen. Pancreatitis results in collection of fluid in the lesser sac. Okay, we have discussed that above the pancreas we have lesser sac. So pancreatitis can result in fluid accumulation in lesser sac, which is called pseudocyst of pancreas. Okay. Next is annular pancreas. It's a developmental anomaly. A ring of pancreatic tissue is surrounding and obstructing the duodenum. Normally, this is how your pancreas is. But due to some developmental error, pancreatic tissue is all over here, surrounding the duodenum. So what happens? Duodenum get obstructed here. Okay. So next, superior mesenteric artery aneurysm. So the superior mesenteric vessels are lying behind the body of pancreas and in front of the uncinate process. So pancreatitis, any infection to the pancreas, may cause inflammatory aneurysm of the superior mesenteric artery. So what is aneurysm? See, normally the artery should be like this. This is aneurysm, like a ballooning. Okay, so this is superior mesenteric artery aneurysm. How can they form? One example is in case of pancreatitis. Okay. Next, we'll discuss the histology of pancreas. Pancreas is an heterocrine gland, which means it contains both endocrine and exocrine. Its capsule, so this is pancreas, it has a capsule, its outer covering, okay, which is dense irregular connective tissue. Okay, the connective tissue enters the parenchyma, dividing it into lobules. See, if this is pancreas, the connective tissue is entering into the parenchyma. So what happens? The parenchyma is divided by this connective tissue into lobules. Okay, so the gland is divided into lobules with interlobular connective tissue separating them. Okay, now the exocrine part of gland, the pancreas contains 70 to 80% of parenchyma, which is exocrine part. Numerous serous acini with small lumens are present. The endocrine part is islets of Langerhans, which is a cluster of cells seen more in the tail of pancreas. So what are the cells in the islets? We have alpha cells, beta cells and gamma cells. The alpha cells secrete glucagon, beta cells secrete insulin, and the delta cells secrete somatostatin. So this is the histology of pancreas. So what are the main identifying points? There are numerous serous acini. See, this is serous acini. There are numerous serous acini. Okay, islets of Langerhans are present. This is the islets of Langerhans. Then interlobular duct is present. This is interlobular duct. Next we will discuss the development of pancreas. Pancreas arises from a large dorsal bud and a smaller ventral bud. See, during the development, which forms two buds. One is ventral pancreatic bud, the other one is dorsal pancreatic bud. The dorsal pancreatic bud is larger while the ventral pancreatic bud is small. Then they fuse, these two buds fuse to form pancreas. So the ventral bud forms the uncinate process and inferior part of head of pancreas, while the dorsal bud, which is the largest portion, forms the part of head, the whole neck, body and tail of pancreas. The duct of ventral bud taps into the duct of dorsal pancreatic bud and opens into duodenum as main pancreatic duct. That means duct of ventral bud and the duct of dorsal bud joins together and forms the main pancreatic duct. But the proximal part of duct of dorsal pancreatic bud forms the accessory pancreatic bud. Okay, so that's all for today's lecture. I hope you liked the lecture. If you haven't subscribed to my channel, please subscribe now by clicking the subscribe button below. Thank you so much for watching the video. Have a nice day. Thank you.